Good day. I am Arthur K. Soberano, and together with me is Cassandra Sanchez, Janna Patricia Ting, Kyla Solidarios, and Roi Aline Tomado. And our research is entitled Attitudes Toward Peer Learning Among Nursing Students During the Blended Learning Setup. The blended learning setup is a learning modality that integrates both traditional face-to-face classes and technology. It provides a benefit to the courses that undergo blended learning as it ameliorates student performance in school and develops their regulation in behavior. Furthermore, constant evaluation and monitoring of the peers has been proven to improve cognitive learning, boost self-confidence, and enhance interpersonal relationships. So for our objectives, the study aims to determine attitudes toward peer learning among nursing students. Specifically, the study seeks to answer the following questions. One, what is the demographic profile of the participants according to age, sex, year level, and area of residence? Second, what are the nursing students' attitudes toward peer learning during blended learning setup based on level of consciousness, personality, ways of thinking about learning, and learning environment? And lastly, is there a significant relationship between the attitude toward peer learning among nursing students during blended learning setup and the following profile variables: age, sex, year level, and area of residence?
Now let's proceed to the methodology of the research. A quantitative descriptive research design was used to evaluate the attitudes of the nursing students. Since the data studied were quantified, the results led to an analysis based on the use of mathematical formulas for statistics. The total population of nursing students is 966 and the sample size was 283 participants with 58 students from first year, 65 from second year, 80 from third year, and 80 from fourth year.
For the research instrument, the study used a researcher-made questionnaire. The instrument was divided into two parts. Part 1 was the demographic profile of the participants, and Part 2 was the 30 evaluative questions that were answered using a 5-point Likert scale, specifically 5 always, 4 often, 3 sometimes, 2 rarely, and 1 never.
Moving on to the results for the demographic profile according to age, sex, year level, and area of residence. For sex, the number of male and female participants showed a great gap, with 212 of the participants being composed of females and only 71 of the participants being males. For the year level, a total of 80 participants each came from the Bachelor of Science in Nursing 3 and Bachelor of Science in Nursing 4. Then followed by the Bachelor of Science in Nursing 2, which is composed of 65 participants, and the Bachelor of Science in Nursing 1, which has 58 participants. For the area of residence, 163 nursing students live within Bacolod City, and 120 nursing students live outside Bacolod City.
Now on to the level of consciousness. In the age variable, 18 to 21-year-olds had very positive results, whereas 22 to 23-year-olds had positive results. In the sex variable, the female participants and the male participants exhibited very positive and positive results, respectively. For the year level variable, the BSNs 1 to 3 displayed very positive results, and BSN 4 students had positive results. For the area of residence variable, nursing students both living outside and within Bacolod City reported having very positive results. Therefore, this research has revealed that overall, when grouped by sex, age, year level, and area of residence, nearly all nursing students' collated data is interpreted as very positive.
For personality based on age, sex, year level, and area of residence indicated different results. Regarding age, 18 to 21 years old had positive personality results, while 22 to 23 years old had moderate results. Female participants outnumbered males, but both had moderate results. Year levels 1 and 2 in Bachelor of Science in Nursing had positive results for personality towards peer learning, while year level 3 and 4 had moderate results. Participants from both outside and within Bacolod City had moderate attitudes for studying in groups or with peers. Some students prefer studying with peers who share personality, finding it motivating and comfortable. However, others feel anxious about working with unfamiliar groupmates, especially outside their peer group.
In terms of ways of thinking about learning, it indicates that all nursing students participants in terms of age, sex, year level, and area of residence have positive ways of thinking when it comes to peer learning during the blended learning setup. Peer learning was found to have numerous benefits for nursing students, including motivation for self-learning, accountability, the ability to identify learning challenges and seek support, respect for peers, improve observation skills, and topic-specific knowledge acquisition.
In terms of learning environment based on age, sex, year level, and area of residence, almost the same moderate results are indicated. Regarding age, 18 to 13 years old had overall moderate results. Both male and female peer learners performed moderately. All factors from the Bachelor of Science Nursing 1 through Nursing 4 exhibited moderate findings, suggesting they are neutral in their peer learning environment during blended learning. Furthermore, participants outside Bacolod City received favorable scores, suggesting they were happy with their learning environment, while Bacolod City residents performed moderately.
In conclusion, nursing students were aware of peer learning and engaged in it. Their personality towards peer learning revealed that they can study alone or with peers. Nursing students exhibit a positive attitude, recognizing the challenges of distance learning and valuing diverse peer interactions. The learning environment moderately influences their engagement through peer support. Certain students encounter obstacles attending in-person meetings, yet their peers empathize and demonstrate flexibility within the group. The study found that sex does not affect nursing students' attitudes toward engaging in peer learning. The study also found that nursing students presented positive attitudes toward peer learning in a blended learning setup, as it provides them numerous opportunities for their learning and academic performance.
And now for our recommendations, the university administrators can utilize the data found in this paper to know what attitudes affect peer learning among nursing students in a blended learning setup. Next, the nursing students can continue engaging in peer learning activities which were found to be beneficial to their academic performance. The clinical instructors can consider incorporating more peer learning activities into the blended learning setup to further enhance the academic performance of nursing students. And lastly, the future researchers that also seek to conduct a study of the same nature are recommended to conduct further studies that delve deeper into the factors or other factors that affect the attitudes of nursing students towards peer learning.
That would be all for our nursing research. Thank you